And one of the V's that is quite often left out is the value. And that's why we were looking at the risk. Companies can only use big data for their value. Like if you use big data, you want the value of the big data. You are not there just to gather data. And that's quite important. And hackers like data as well, to sell your data, to release the data just to prove that they were able to access the data, or to use the data against the person that they stole the data from. In the last couple of months, we've seen quite a lot of ransomwares, and they are now targeting, for example, hospitals. There is UCLA hospital had to pay $17,000 because their data were encrypted. This happened also in Belgium. NHS is facing the exact same problem as well. They've not been hit by a ransomware, but in the latest report, they said they had 5 attacks every single day, 5 actually intrusions every single day, and this is becoming more and more important. A lot of private companies that are gathering those data do not tell their customers about breaches. So, as I said, 82,000 malwares in 2013 detected by Panda Labs, 200,000, that's my French, sorry, 200,000 new malwares in 2014, and this is only going to improve. So we need to know what people know about risks once they're monitoring their data, monitoring their health. So we got 273 participants, and as I said, from multiple horizons. We didn't choose only participants with a background in IT. 110 students from 4 different universities, and we are looking at expanding. So we are looking at new collaborations. If you want to give this survey to your students, please come and see us. Then we decided also to look at Amazon Mechanical Turk, and this is done quite often in psychology. Mechanical Turk is a service made by Amazon where you pay people for their time. So for a 20-minute questionnaire, you can give them for $1 or $2. We got 150 participants. 2 of them were discarded because they simply answered the questionnaire for the money. And we chose master workers, and that means that the workers, like all the people that have taken the test, are people that have been paid before and have achieved at least 1,000 other tests. So they have to be master workers, and this avoids people that just signed on the Amazon Mechanical Turk and that are just doing that to get $1 or $2 and that are going to do as much as possible. So we ensure the quality of their answers. And then we asked 15 IT professionals, mainly in Belgium, from different large companies, to take the test as well. And basically we asked them based on a few scenarios to classify security and privacy, just to have an idea. As you said, security and privacy go together, but we wanted to see, do they understand what security is on its own? Do they understand what privacy is? And quantify the likelihood of attacks. So we crafted a couple of scenarios, we told them the scenarios, and we asked them, do you believe this might happen to your data? And then we had a look at their awareness, and this is an ongoing process. So we are going to publish more about this based on the results, and based on the new results, we are looking at more companies. We are looking at governmental agencies as well right now, just to see if they understand also the risk. And those are basically the results. And as you can see, quite a lot of people, and those are the risks, the severity of attacks. So we asked them to rank the severity of attacks that might or might not happen. That's not the problem. We just wanted to have an idea of what they thought might happen. And most of them ranked identity theft as quite important. So they believe that if you are gathering health data, you might be impacted by identity theft. And it's the same for refused health insurance. So quite a few people believe that they might be refused health insurance if they use a wristband, and I'm not going to give any brand here, but if they're getting monitored, they are thinking that the company might share data with health insurance. This has not happened yet, not like to the best of my knowledge, but it could happen. And basically, those are simple results. They are not that concerned about the loss of privacy, for example, which yesterday we had a talk. They are so over 40% are concerned about the loss of privacy. Some of them, quite a lot of people, ranked the loss of privacy to a severity of 6, which is questionable, basically. Once you know that you can identify a person based on his heartbeat, and that there are quite a few companies around the world using that as a logging mechanism on computers. We then asked them to rank the likelihood of attacks. For example, data theft. They believe that it's not likely at all, even though hospitals have been impacted by data theft. And a lot of companies with like major brand names that are gathering data are also impacted by data theft. And that's quite representative of the population, because they see a service. They are receiving a service, and they believe that the service is secure. They don't question where the data is going, what people are going to do with the data, what the company is going to do with the data, what the hospital, how the hospital is storing the data. They also understand that cyberbullying is not likely. And that's quite interesting, because in the last couple of months, there has been at least one child committing suicide. And this was in the news. He shared his data on Facebook, on social media, not specifically Facebook. He shared his data on social media about weight and his weight loss and his progress. He got cyberbullied, and he actually committed suicide. And most of people are not aware of this. And this is what we wanted to understand, basically. Home theft, for example, is not that likely either. And even though yesterday we had a quite nice talk with one of the speakers that said they are monitoring a university with different sensors, and they're able to see who is going to the toilet and where they come from and if they wash their hands. And basically it's the same once you're sharing your data on Facebook or on the other social media, that every 2 days you're away running for 5 kilometers. Well, you might be subject to home theft. And that has happened before, even though nobody seemed to be too much aware of that. So as future work, we are looking at creating a guidelines with European laws to store the data and to include privacy by design. And this would be focused on startups. There are quite a lot of startups, if you look at Kickstarter, for example, that are willing to monitor your health. They often, by our discussion, do not look at the security side of things because they have a limited budget. And we are now looking at trying to provide them with a cost-effective guideline, which is going to help them to secure the data that they are gathering, and also to provide their users with accurate information about what they are doing, how they are doing it. We are looking at collecting more results through our current partnerships and future partnerships. So if you are looking at, if you want to take a survey, please let me know. If you know people that want to take a survey, and that is unfortunately not likely, please let me know. We are looking at publishing an extensive analysis, because this was a preliminary analysis. We just wanted to to have an idea of what was happening on e-health and basically on the customer side. And then we are looking at creating a user-centered awareness methodology with a focus on security and privacy, and that is usability, like with usability by design as well, not to make it too complicated for the user. And this is done with our sociology department at Abertay University, which they seem to be quite interested in user-centered security and privacy. So thank you for listening, and